It's another exciting episode of the show where we get to get informed about healthy practices that help us to live a more healthier and happy life. This is Nonye's Healthy Living Show. Welcome to the program. My name is Priska Wanko. Today on the program, we're going to be looking at something that is often overlooked. Overlooked why? Because a lot of people are actually guilty of doing it. And because they don't even feel that there is anything wrong with it, they keep on doing it, not knowing that they're actually causing more harm than good for themselves. Some people will say it's a silent threat that keeps festering with no hope inside. But we decided to come today and look at this silent health threat. What are we talking about? We're talking about self-medication. You have a headache, you pop painkillers, your stomach is turning you go buy flagyl, tetracycline and the likes without any diagnosis. You just keep popping pills. Do you know what those pills does to your body? Do you know that self-medication actually harms you or not? Well, today we are here to, answer all these questions and educate the public, because the Yes Healthy Living Show, it's not just about educating, it's also about providing information for people to make informed health decisions about their well-being. And that is why today on the program we intend to look at self-medication and the misuse of painkillers, what harm it does to us. And of course, I'm not going to be doing this alone, because I have experts that are well trained, that are better equipped to provide answers to all these questions. All right, so joining the conversation today on the program, I have pharmacist Dr. Edith Anyakwo, consultant clinical pharmacist, and Deputy Director of Pharmaceutical Services, Namdi Azikiwe University Teaching Hospital, Navy. Pharmacist Edith, welcome to Noya's Healthy Living Show. Good evening. We're glad to have you. All right, of course, a pharmacist Edith is not alone. Dr. Tonia Mbago is also here. Dr. Tonia is the Anambra State HIV/AIDS Program Coordinator. Dr. Tonia, welcome to the program.
Friska, thank you for having me.
Okay, well, you're the HIV/AIDS Program Coordinator. I know we're talking about self-medication, but I just want to ask, with the recent information that the United States President has said that there will no more be funding for HIV and AIDS to Nigeria and other countries, how is it going to affect the work you're doing? Let's digress a bit.
Okay, thank you for that question. The fund that was stopped was for PEPFAR supported sites. Okay. So in Nigeria we have 36 states plus one, that's the FCT, and amongst the 37 states put together, we have 4 states that are global funded, okay, of which Anambra is part of the global funded states. So Anambra State, for now, we are exempted, we are not affected.
Oh, yeah. Okay. All right, let's get back to the focal point of discussion today, which is self-medication and painkillers, the silent health threats. And remember, like I said earlier, it's silent because people do that. People pop painkillers and they don't even know that there is something about those painkillers that keep popping. There is something about it that is not actually so good to their health. Well, pharmacist Dr. Edith is here. She's a professional when it comes to drug administration. So we'd like to understand, when we talk about self-medication, what do we really mean? And why do you think people engage in it randomly?
Okay, simply put, self-medication can be defined as a situation or the practice or the act of people just taking drugs without getting proper prescription, be it OTC, which we call the over-the-counter drugs, prescription drugs, or even herbal drugs or supplements, without getting a proper prescription from a health practitioner. Now, there are various reasons why people may subscribe to self-medicating. The most common reason is convenience. Sometimes people might find it difficult going all the way to hospitals when they can easily access the next pharmacy or even patent medicine store.
The one they call chemist.
Yes, the one they to get their medication. So it's convenient. It's usually more convenient. It's cheaper for them. like I just said, instead of transporting yourself to maybe a long distance to go get drugs, you can just access somewhere that is closer. You don't have to pay for any card. You don't have to queue up. So these are some inconveniences that people think about that make them self-medicate. And then on the other hand, sometimes you could just tell somebody close to you that you're having certain kinds of symptoms, and the person goes, "Oh, I had the same symptoms some days ago, and I tried this." It might even be a home remedy. It doesn't even have to be an orthodox medication. It could be herbal. It could even be something that you cooked up, in your house, like I said, home remedy. But once it comes without prescription, it's said to be self-medication. It could even be supplements. So there are a lot of reasons. We have cultural reasons. We have traditional reasons. We have the fact that some people have lost confidence in the healthcare system. Sometimes people might have gotten negative experiences. For instance, imagine if you maybe had an emergency and you took your loved one to the hospital, only to get to that place and the person was not well attended to, or attended to fast enough, and the person ended up losing the loved one. Such people will develop a kind of phobia and wouldn't want to have anything to do with the hospital anymore. So, and then sometimes lack of awareness can also lead to that. Some people don't know that you can actually go to the hospital for simple things like headaches, or that there could be underlying ailments attached to something as simple as a headache or a stomach upset. So they just feel, oh, if this is something I can actually treat on my own,
Why
why
do
go
I
all
have to
the
go
way?
to
Do you
hospital?
understand? So these are some of the reasons why people self-medicate.
Okay, all right. We're talking about self-medication and painkillers. And painkillers because that seems like the one that is always easily available and accessible to people. Like, all those analgesic that it will just pop. If they feel pain, they just pop it. If they feel headache, they just pop it. So, okay, what I would like to know is, these painkillers, are there any potential side effects? How do they work? Yeah,
Okay, all
Dr.
right.
Tony.
Yeah, thank you for that question. So what painkiller actually does is it works with the brain, right? It blocks the signal that goes to your brain. Your brain sends signal to your body and picks the pain receptors. So it hinders, inhibits the signal going to your brain. Okay, so you take it and you feel good. And stopping the pain does not mean that the ailment, what causes the pain, has stopped. Okay,
Just
you
stop the
you you
pain for the
stopped feeling
moment.
the pain, but the condition is still ongoing, right?
Okay. Okay. So, okay, rather than tackling the root cause of the problem,
Yeah, you
you're
just
numbing the problem, more like the problem is still there, but it's not evident, and eventually it might crop up. Okay. All right. So, what are some of those most commonly abused painkillers in the country, and do they pose any health risks, like the ones we take for headache, the ones we take for stomach pain, body pain? What are some of this,
Yeah,
and do they pose any health risk?
sure. The one that really comes to mind is the paracetamol,
Uh,
the one we call Tylenol abroad, or it belongs to a class called acetaminophen. So many people take that for headaches, fevers, and stuff. But when they are misused or um, not used properly, they can actually lead to liver problems.
oh wow.
And then when they are used for prolonged period of time, even if you're using them properly, they can cause kidney damage.
wow.
And that's why you've noticed that there is an increase in kidney problems right
Yeah.
now in Nigeria, because many people use those painkillers erratically and haphazardly without getting prescriptions. And even if they do, and they think they know how to take them, because they've taken them over a long period of time. Sometimes it might be headaches that are associated with stress, or that might require lifestyle change and all that. But they just keep taking the paracetamol because they need to make ends meet. And then at the end of the day, they're coming down with kidney problems. And then we also have other drugs like the NSAIDs, the ones that we call the non-steroidal anti-inflammatory drugs. Now, the drugs that fall into that category include ibuprofen, Motrin, and diclofenac, and some other ones. Now, those ones predispose people to stomach ulcers, when taken over time, because they kind of erode the stomach lining or duodenal nylon. So, and then when they are taken over long period of times, they can lead to internal bleeding, and it can even lead to hemorrhage and stuff like that. So these are some of the things that we need to create awareness so that people don't just think that these things are basically harmless. Even the antacids that you mentioned that people take for
Also?
indigestion
Okay.
and everything.
Bloated
Yes,
stomach.
they
Oh.
could cause constipation, and over long use, they also have a lot of hazardous effects on our kidneys, on our livers, and I could go on and on. There's a
Okay,
whole lot.
all right.
But I will
Okay, yeah, you said something about over-the-counter drugs and prescription. I know that in civilized climes, like I've seen a lot of in climes. I've seen some movies, some American movies that somebody goes to the pharmacy to get some kind of drug, and the pharmacist over the counter is saying, "Can I get your prescription?" And the person will say, "I don't have a prescription." The pharmacist will say, "Sorry, I can't do that. You need a prescription for this drug. I can't dispense the drug because you don't have a prescription." But here in Nigeria, I don't think that's the case. I can just walk to any pharmacy. But I know that we'll get back to that. I think there should be some drugs that are not allowed to be sold in pharmacies here in the country that you must. Okay, so now our practice. This is not our practice, Dr. Tonia. Do you think it's something that we can incorporate in our healthcare system to help prevent this abuse of pain meds? When you go to get drugs, you come with a prescription.
Okay, just like the saying goes that Rome was not built in a day. Okay, it's something we can actually incorporate in Nigeria. All right, we have bodies, the pharmaceutical bodies come together and they agree. When the MD comes together and say, this is what we stand for, it's established. So if the heads of the pharmacy, I don't know what they call the association, when they come together and say, we no longer dispense drugs without prescription, I think it will stand. But I think one of the challenge there is that most of the drug dispensary homes we have are not run by a pharmacist. Okay, we have people who go to learn how to sell drugs. If you choose not to sell as a pharmacist, some other person will get your market, okay, and they would thrive by it. People thrive with our ignorance, but I think we can set up that pace. We can start something towards that direction. But just like you mentioned earlier, there are drugs that you can't get without a doctor's prescription, okay? Drugs like codeine, tramadol, regardless, I know some pharmacists also sell.
Pharmacists. That's why you're laughing.
Yeah, they do
You like
sell.
say some people
They
manage
do, they
to
do
have
sell.
the system.
Okay, but it's restricted in the market. Yeah.
Okay, that's the official rule. It's not meant to be sold. Pharmacists,
Well,
is that it?
the truth about it is that it's not supposed to be sold anyhow. But because it's difficult to enforce some of these things, of course we have organizations like we have the NAFDAC, we have the Pharmacists Council of Nigeria, and we have a lot of bodies that try to regulate the dispensing of these drugs and everything. But you know how it is. Our environment makes it difficult.
Yeah.
In saner climes, like you said, drugs are not sold in the open market. It's not done, and that helps regulation and enforcement. But here, you can actually work to practically every market, in every environment, and you have a place where drugs are sold. Any kind of drugs, be it prescription, over-the-counter drugs. We know the battle. I'm sure it's common knowledge. They are going the battle, with the people at the head bridge.
Yeah.
And rumors have it that even her death could be traced to it.
Oh, wow.
Do you understand? And eventually even her husband's death. So it's a monster that the pharmaceutical society is trying to deal with. But then we also have to sensitize people. Because if the people are not willing to buy, then their markets will be grounded. If people were sensitized to the point of not patronizing these people, then they'll be out of market. But here you find people who would rather go to these people, these illegal drug vendors, than come to professional pharmacists to get whatever it is they want to get. And as far as they are concerned, it's all about, which is cheaper. They don't care about the storage conditions, how they've been stored. Sometimes the expiration dates might be okay, but these drugs are no longer effective because they haven't been stored in proper conditions. And there are a lot of other factors to consider, but then Nigeria is what it is.
Huh?
So,
It's
like she
a,
said, Rome is not built in a day, so we're hoping we'll get there.
but our own is that we don't even want to even start building the room. Let's talk about when we finish building the room.
Yes, because it's supposed to be a collaboration between the general populace and these enforcement agencies.
Okay.
You can't do anything in isolation. If you're going to get people to stop, even drugs are peddled in our buses.
Yeah.
Do you understand? On the roadside, you see people always, campaigning, saying all kinds of
I've actually
things
been
that
a
are not
victim of
true.
that.
Staphylococcus, a lot of ridiculous things, and these people get high patronages. Some of them even they go online and they market some ridiculous products that are ineffective and will probably not have any therapeutic purpose or achieve any therapeutic purpose, but they're out there, and people are, gullibly buying these things on a daily basis. Do you understand? So it's something that warrants some kind of collaboration. It's everybody's business. But here in Nigeria, we've gotten to the point where everybody minds their business and turns the other way around. Do you understand? And feels, oh, it's not my thing. But if everybody were to put hands together, I'm sure we'll be able to do something and fight the syndicate.
Okay, Dr. Tony, pharmacist Edith said something when she was talking about some of the reasons why people would prefer to self-medicate as opposed to going to the hospitals to get proper prescription, being that most of them have lost faith in the healthcare system, or probably they have one horrible experience when they went to a health center and they don't want the experience to repeat itself. So they rather play it safe and they decide to just get the drugs on their own. Now, what is the place of our healthcare system with regards to this pandemic of self-medication and abuse of painkillers?
Okay, so it's true that I won't deny the fact that some of our healthcare practitioners are not welcoming. They are not nice. Okay, she mentioned something like, she said convenience. Sometimes they patronize the patent
Yeah, you think
drug
how you go
dealers.
to the hospital, get card and
You
waiting
know,
and all
the
that.
convenience. I would liken it to going to the bank. Okay, when you say you want to go to the bank today, you just bring out the whole day for the bank. Okay, the same thing applies, also applicable to the hospital setting. I want to go to the hospital. I have to cancel going to work that day because I know definitely I'm going to spend all my time there. We are trying to decentralize the burden of the bigger healthcare facility. We have over 1,000 primary healthcare centers. So if you feel going to the teaching hospital is going to take your time, you walk to a public health primary health center. Okay, we have what's it called? Equipped. We have equipment there. We have equipped.
Facilities, healthcare facilities.
Yeah, healthcare facilities. We have nurses. Sometimes we have doctors there too that would attend to you. So the governor is doing something about it, definitely. The governor is doing something about it.
Okay, all right, Dr. Edith, I want to ask something. Now, herbal remedies, herbal remedies and natural herbs and all those things, do you think there are a safer option to painkillers?
Yeah, they could be if approached logically and carefully. Because one has to be very intentional about the use of herbal remedies. Because there's this common myth that because they are natural, supposedly natural, they cannot be harmful. But that's a myth. Because we also have issues with dosages. We have the packaging, then the storage. Do you understand? These are issues that could compromise their safety. You understand? But when these things are properly standardized and with the guidance of whoever it is, like I said before, self-medication is not restricted to orthodox drugs. You can also self-medicate even with herbal drugs or remedies. So if one is properly guided, it can actually be a safer alternative.
Okay.
Yeah.
All right, so can self-medication contribute to antibiotic resistance? Like, is there a point that you keep popping particular painkillers and your body becomes resistant to those painkillers, Dr. Tony?
Sure. I think we should talk about drugs that are mostly abused.
Yeah, she
Drugs that,
mentioned them.
okay,
Yeah,
so
she mentioned
when
it
we
earlier.
talk about painkillers, okay, you also bring into bear the anti-malaria medications.
Is that one
Okay,
also part of it?
sure,
Yeah.
every symptom when in our setting, when you have headache, when you have cough,
It's
the
malaria.
first thing you think about
It's
is malaria.
malaria.
So anti-malaria medications are also self-medicated and abused. Okay, antibiotics, just like she mentioned, cough syrup. Some people can be addicted to cough syrup, right? So when you take antibiotics without prescription, you tend to make the virus, the bacteria resistant to that particular infection, right? Sometimes when you've patronized all sorts of antibiotics and finally you find yourself in the hospital, you do a drug resistant testing and you find out that the patient is almost resistant to all types of the antibiotics, you don't have any other choice than to go to a higher brand, a higher family of that antibiotics. Okay, so it causes drug resistance.
Okay.
Antibiotics, drug resistance.
All right. You know, I've read somewhere in some research that research has actually shown that a lot of people that end up being drug addicts or end up being addicted to a particular pain med, it started from a prescription when they were ill or when they had something that took them to the hospital. You understand? And eventually they kept on depending on those pain meds. And when they finished their prescription, they kept on taking it. And before you know it, they became addicted to those pain meds. So what I want to ask is, are there signs or symptoms that you could see and you will say that this person is actually misusing or overusing a particular pain medication?
Sure, there are various signs. We have the physical signs, and sometimes that might present itself in the form of, sedation, constant drowsiness, depending, there are actually different classes of pain medications.
Oh,
You
okay.
know, like I just mentioned, the acetaminophen and the non-steroidal anti-inflammatory drugs. We also have pain medications that are opioid in nature. Now, these pain medications actually work by attaching themselves to the opioid receptors in the brain and the spinal cord.
Oh, wow.
And what these how they work is that they kind of block the production of what we call prostaglandins, which are chemicals that are responsible or that are released when there is pain. So, in other words, just like she tried to explain, it just blocks the signal.
Okay.
The pain is still there.
Okay.
And many people think that pain is a bad thing, but it isn't. Pain actually helps you to know when to stop. Because if you're feeling pain on your legs right now and you try to step on it and it's very painful, the likelihood that you would resist from doing that is very great. But in a situation where people have taken so much opioids and they no longer get that signal of pain, they'll keep stretching those organs, despite the fact that the body is screaming through the sensory pain nerves that there's something wrong and there's an underlying thing that needs to be taken care of. But because they are not listening, because the signals have been cut off, they just keep going. And then eventually, some of these effects, the long-lasting effects are fatal.
Wow.
That's why sometimes you hear that there was a time that tramadol became a community menace in Anambra State.
Yeah.
I used to take plenty of tramadol, combine it with codeine, and all these are opioid painkillers.
And joining them together
Will aggravate the side effects.
Wow.
So you find out that sometimes people just have respiratory depression. They could just fall, collapse, start having seizures, and from there, they're gone. And this practice of masquerading and everything, where they want to show that they are men, and no matter how hard or how many times they are flogged, they don't feel the pain. Doing such cultural practices, you see our youths taking all kinds of combinations
Just
of
to,
pain, to toughen
be
up,
immune
and
to
then
the pain.
and everything to cut off the pain. So these are some of the things that we notice. And your question again, because I
Yeah,
was
that was
trying to
what.
clarify
No, of course, that was what
certain
Max.
things.
Max saying, okay, what I'm saying is the signs that you will see
Okay.
and say that this person is misusing or abusing.
So sometimes, like I said, sedation, extreme drowsiness. You notice that no matter what the person takes in, there's extreme nausea and
Into to
vomiting. They
get
just
it
keep
out.
food. They can't keep anything down.
Wow.
Then impaired cognitive function. Do you understand? Slurred speech. Then these are the physical factors. Then the psychological factors. The person might start withdrawing, start isolating his or herself from family, from friends, who prefer to keep to themselves.
Oh, wow.
Because, yes, it's something that people kind of try to hide.
Okay, they don't want other people
So,
to know.
yes, they don't want other people to know. And then when it starts happening, they start to try to hide or kind of cover up their deficiencies because they notice that they are no longer as sharp as they used to be. There is an impairment in cognitive function. Maybe by the time you ask the person, a normally sharp person, some questions, they take some time. They take some time to even sort of like analyze the questions, appraise it, and before they can answer. And then you also notice that sometimes because these drugs become tolerant, as in there's this tendency to become over-dependent. They can no longer function with the normal dosage of drugs that they
So you
used
have to take
They
more.
have to keep taking more.
Wow.
Do you understand? So it leads to tolerance, it leads to dependence, and you see it from their looks. With time, it starts affecting their finances,
Wow.
the economic aspects of their lives.
Because they will have to spend all their money
Thank
getting
you.
them.
And then even their general care and appearance starts to go down, starts to deep. And then maybe very intentional people now become careless. They become aggressive. If you try to invade in their privacy, so-called privacy, they could get aggressive,
Oh, wow.
very angry, throw tantrums. And then you see maybe students that used to do very well, if they're still undergraduates or they're still students, they start declining academically. So it's all embracing. There's that economic effect, there's the academic effect and everything. So the signs are there. If you're very sensitive and intentional, it's not difficult to pick.
To pick, okay. All right. Dr. Tonia, sometimes you see people taking malaria drugs or taking certain type of drugs, and they will tell you, you will go for a hangout. Perhaps they tell you, no, I'm on drugs. I can't drink. I can't take anything. And you still see some persons, they are on drugs and they don't mind. They will keep taking alcohol, popping drinks, and doing those sort of thing. What I would like to understand, what are the dangers of mixing medications with alcohol or even mixing different medications, like combining two pain meds together? Do they not have this sort of interaction in the human body? I don't know. You guys are the experts.
Of course they do. In fact, that's why we're here as pharmacists.
Okay.
Now, if you're talking about alcohol, alcohol has this depressive effect on the CNS. And so when you take, for instance, combine alcohol with painkillers, they further depress the respiratory system. Do you understand? And this can lead to strokes. This can lead to cardiac effects. The effects can actually be very fatal. And you mentioned people who take something as common as flagyl for stomach upset.
Yeah.
It's a no-no for you to combine flagyl with alcohol.
Oh.
In fact, we even cancel patients about that. We don't. Even if you have to take alcohol, wait till you're done with your flagyl. And then there are a lot of other combinations, very little combinations. Okay, she works with HIV care.
Okay.
We dispense drugs to, I work in a tertiary institution that deals with HIV patients. And one of the things we advise our patients who are on ARTs is to avoid what we call the bitter cola. They're not supposed to take those drugs. Yes, because it kind of reduces the effectiveness of antiretroviral agents.
Wow.
You're not supposed to take your antiretrovirals with alcohol. even something as common as our coconuts. Yes.
That
I
one. So
think
that's the meat.
that goes with
Most drugs.
most
Yes,
medication
yes,
because
yes.
Coconut,
they
is that a
dilute.
meat for real? Is that a fat or a meat? This
They
No,
dilute
coconut
one.
it's
aspect.
not. It's kind of dilutes.
Coconut.
Yes,
You
coconuts.
know, I've been hearing that. I just thinking people are just, just normal wine
And
and all
even
that.
our normal
Palm
caffeine,
oil.
cola nuts, it
Wow.
contains caffeine.
Yeah, yeah, I know that. I've heard
So
that.
when you take, and the effect of caffeine on some drugs, it can aggravate, some medications, give it an addictive effect. It
Wow.
can make it more active, and thereby, because the more active a drug is, the higher the tendency for the side effects to be more.
Wow.
Yes. In olden days, when our uh, elders kind of take medications that they feel are going to work, their way of testing it was by telling you the effect it had on his body. They will go like, I took this drug and honestly, my body felt it. But sometimes, unfortunately, those were side effects. Do you
Wow.
understand?
Wow.
And the fact that a drug has very serious or very potent side effects does not. The extent of the side effect is not commensurate with the therapeutic effects.
Wow.
Just because the side effects are kind of powerful and potent does not
Doesn't
mean
mean.
that it's going to be very therapeutic.
Okay.
That's also a myth.
Okay.
So these are some of the things.
Okay, okay, and now talking about healthcare providers, we've been talking about self medication and painkillers, a silent health threat. And it's termed silence basically because people pop a lot of pain meds. Somebody is sick, you say it's malaria. Somebody's stomach is, I'll just go get flagyl, I'll just go get cycline, and I will be all right. It's because we do it. It's already a habit, and we don't see anything wrong with that. What I want to know is, as healthcare professionals, what do you think it's your role with regards to curbing the menace of self-medication?
You won't do without sensitization. Okay?
Okay.
It's just sensitization, sensitization, sensitization. Sometimes when you take these medications, they tend to mask symptoms. Okay, I will give you an instance. Most of the cases of ruptured appendix we have in the hospital are as a result of painkillers and antibiotics. Okay, like I said earlier, what this painkiller does, they inhibit the sense of going to the brain. The brain, it stops the signal. You stop
The pain
feeling the
signal.
pain, but the harm is still there. It's still progressing. So you feel pain towards your lower abdominal region, and you go to the chemist. They mix, we know what we call mixing of drugs. So they mix all kind of painkillers for you. They give you paracetamol, they give you diclofenac, they give you ibuprofen, they give you antibiotics. You take it. After 3 days, the pain comes up again. You still go back to the same chemist store, and before you know it, the patient is bad. So most of the emergencies we have in the hospital are as a result of self-medication you take because your neighbor had told you this worked for me, okay? And because it worked for A, you want to take it as B because it's going to work for you for sure. So what we are doing as healthcare provider, you would not stop going to the bank because of the attitude of the banker. Okay, so the same way you won't stop going to the hospital because the nurses did not attend to you very well. So good to us. We don't just have one healthcare providing center. So if you don't like the attitude of hospital A, you go to the next center and get your medication. So we do well by media publicity, just like what we are doing, what we are having now. Okay, then just sensitize the public. They should know the risk of self-medicating. They should know the risk of self-medicating. Sometimes it feels good. Sorry, I have a personal experience. Okay, many years ago I had a surgery, and they were giving me paracetamol and diclofenac. At a point, I no longer felt relief from it. Okay, and then the nurse came in with Penta. I don't know if I'm permitted to mention. I'm not saying we should go for that. Okay, so the nurse gave me Penta, and within 5 to 10 minutes, I dozed off. And around 4 hours or so, I woke. I knew I felt good. Okay, I felt so good, and I was craving for that medication. I was pleading to. At a point, I had to call a colleague in the hospital. Please, can you? It took me self-discipline to resist from getting that drug for myself.
Wow.
So it can be,
There's
you
a
feel
thin
good.
line.
There is this tendency. At a point, you feel so dependent on it. You ask the question formally, how do you know that this person is
Showing signs of
yes,
overusing
dependence?
or...
When you see a person and the person tells you, for my headache, if I don't take tramal, I'm not going to be fine.
Yeah.
So you know that there is a dependency.
problem.
Yeah, there is a problem
on
there.
there.
Or they tell you, I have a cousin who doesn't take 2 paracetamol for headache.
Yes.
He must take 4.
Wow.
We have
Okay,
people like
so
that work into the pharmacy, and you're telling them 2 tablets. They say, what's that?
one,
That
it
doesn't work
is
for
a
us.
pediatric dosage.
Mhm.
Okay, so you just have to keep sensitizing. You have to keep and self-discipline. I think that will go a long way.
But is that even healthy? What you're saying about the 4 paracetamol?
Of course it's not, but that's a classic case of dependence. And just like she said, aside from public awareness, we have to carry out maybe outreaches and programs that would further try to enforce and ingrain some of this information in the minds of people around. And then secondly, we have to educate people, go to the grassroots, catch them young, maybe do lectures in secondary schools, because honestly, so many people are using drugs even at the secondary school level.
Sure.
They are no longer waiting to get to the tertiary level to do all sorts of things. Then there has to be a way to monitor the use of certain drugs. You have to take responsibility, and that's why if they get these drugs from the right sources, it's now left for us to, monitor them. How you taking this drug? Or isn't it time that, because there are also situations where people walk into the hospital and they get proper prescription drugs, but the doctor fails to tell them that, there is a terminal stage to the usage of that drug. So some of them just continue using. And because it's helped them in the past, they go and they purchase more and they just keep using. And just like she said, maybe if they find out that it's no longer working for them, they go add some other stuff to it. And there are so many drugs that are not supposed to be used over a long period of time. It gets the work done, and the intention is for you to stop it, or people don't, because they are not told, either out of ignorance or because they don't just know, and they feel, because the doctor gave it to me, then it's safe to continue using it. So we have to carry out, proper monitoring, policies. We change our policies. Decision makers have to find a way to enforce proper usage of drugs.
And I also think engraving those the side effects on the leaflet of some of our consumables, okay, would also go a long way. Just like the cigarettes, when you read the pack, you see smokers are liable to die young. Regardless, people smoke, okay? Then keeping drugs out of reach of children. Keeping drugs, I think that we have it engraved in almost all leaflets. They say
the leaflets are there, but
how many people?
Yes,
so
it's
part of the
sometimes they are also
sensitization.
very scary. Because if you see the side effects that are attached to many drugs, you might not even want to touch
It's better, it's even safer you know the side effects, so you don't exceed. You were saying doctors don't tell them. I don't think a doctor would give you a particular drug and ask you to continue. They either tell you to stop after 3 days, after 5 or 7 days. Okay, so it's now left for you to now, because you feel good, just like I mentioned, I felt good with a particular drug, and you want to continue making use of those drugs. Yeah, that's just basically it.
Okay, we're still talking about self-medication and painkillers, a silent health threat. And I've already talked about why it's silent, because people do that. But just remember that just because everybody is doing it doesn't mean it's actually right. All right, so come back to you, pharmacists. So, what are the role of pharmacists, such as yourself, with regards to tackling this issue?
Okay. Education and awareness. Then counseling, patients counseling. Just like she said, if people know what these drugs are capable of doing, both positively and negatively, they are they'll be much more careful. Because
While
one of the
using the
first things we're taught when I was in school was the fact that every drug is a poison.
Sure.
Every single drug, even the common paracetamol that we pop anyhow and every time. If people knew that by taking and popping paracetamol anyhow, they are, likely to cause damage to their liver and their kidney. Of course, they'll find other ways of
alternative
dealing,
means.
yes, alternative ways of dealing with the pain. Instead of stretching yourself too much that you need to sleep, you could just pack up and, oh, I've had it for today. Let me catch some rest instead of extending and overdoing it. And then we also have what we call pharmaceutical care. That's where we not only tell and advise the patient on how to use it, but the duration, the intervals, you know. When you walk in, and that's the difference between a proper pharmacy and a patent medicine store.
The ones we call chemists.
Yes, because you could just walk in and they tell you, oh, take this 2 times a day, 3 times a day. They are not mindful of the dosage interval. There are drugs that, yes, when we say 3 times a day, what it actually means in pharmaceutical terms is 8 hours apart. So the pharmacist can help you to tailor the usage of these drugs. Tell you, oh, it's not just enough for me to tell you, oh, 3 times daily. No, take this by 7 a.m., 3 p.m., 11 p.m. Be specific. Because if you tell somebody 3 times a day, the person could decide to take the first dose by 9 in the morning, and then around 2 in the afternoon remembers, oh, I'm supposed to take this in the afternoon. Afternoon is afternoon to him or her. And then she just rushes in, takes another one, and by 6, the person is taking another one. Meanwhile, these drugs are supposed to be taken at particular intervals. We have 6-hourly drugs, we have 8-hourly drugs, we have 12-hourly drugs. So these are some of the things that pharmacists do. And then we're supposed to monitor your medication therapy. There's something we call idiosyncratic reaction in pharmacy and in medicine. The way I react to a particular drug, even though it's supposedly safe in 99% of individuals in the world, might be different. You might just be one of those 0.1% of people that it doesn't go down well with. So just because it's a common drug that is well tolerated by everyone and almost everybody does not mean that we should negate the fact to monitor the patient's reaction, therapeutic reaction and otherwise, to that medication. So you're supposed to be monitoring, checking the person's vital signs. If possible, subject the person to certain tests, like kidney function tests. If it's a diuretic that is supposed to affect electrolyte levels, the person should be subjected to some kind of electrolyte tests from time to time, especially our elderly, to make sure that these drugs are now no longer causing harm or have not left the good they are supposed to cause in the body and are causing undue harm. Because like I said initially, every drug is a potential poison if used abnormally or used in a way that it was not created to be used. So that monitoring is very important. Then counseling, especially for HIV care, the side effects are grievous. So if these patients or our clients, like we like to call them, are not aware of the benefits of these drugs and the implications of taking these drugs on a daily basis, they might just get discouraged and say, oh, why should I keep popping pills all my life? It's not easy. Because some of us that have been maybe exposed to some of the hazards of taking care of these people and have tried to take these medications will tell you that it's not a joke. These people are trying, because when you talk to medical professionals that have had maybe injection pricks, they have had to take what we call PEPs, which is the post-exposure prophylaxis, so that the person doesn't come down with HIV. Just for 1 month, it's not a joke. You have all sorts of side effects and everything. So when you collaborate with not just the patients, but the doctors and other members of the healthcare team to make sure that our patients get the best out of their treatments. It also helps to improve their confidence in the healthcare system. Because most people think, oh, what do pharmacists do? You just sit down there
and give drugs.
You just count drugs. Is it not the doctors that write the drugs? So apart from producing the drugs, it's just like saying that somebody who is a mechanic knows better about Ford, somebody like Ford that builds the car. Do you understand? We make the drugs, so we know everything concerning those drugs. The way they work, the effects, the negative effects, the positive effects, and everything. And we're in the best position to tell them how to even combine the drugs. There are situations where, especially for the elderly, where they have to take a lot of drugs at the same time. It's not easy. So pharmacists would also help to tailor the usage of those drugs so that they don't interact and cause more harm than good. Because if these drugs are not used properly, somebody that came in with pain could end up going back with an ulcer. Somebody that just came in and just had a fever could end up going with osteoporosis or some other negative thing. So we're here to make sure we as pharmacists and the healthcare units just make sure that everything that has to do with drugs are done properly, in order to achieve the best.
Okay, thank you very much. All right, as a roundup, I'd like to hear from you, Dr. Tonia. Now, we'd like to know how we can control the sale and misuse of over-the-counter medications. Is this something that is actually possible? The both of you are laughing. It'd be like,
Because she's a doctor. You should be asking, you basically ask her questions for me.
Okay.
The question should be directed to her.
But you're a doctor now, you should have your own opinion too, in as much as she's the pharmacist too.
Okay, that I thought I said something concerning that regulation. Okay, the NAFDAC, the bodies that see to.
So you think it's possible?
It is. It is, sure.
Yes.
It is.
Even in very close African countries like Ghana, Togo,
you don't get drug over the counter.
Ghana,
you can't get drug without a prescription.
So really? If it's possible,
wow.
yes.
It's possible.
So if you can work in Ghana, you can work in Nigeria, is what you're saying?
Of course.
Interesting. Okay. Ghana has light too, but let's not digress.
It's all part of it.
Okay.
So I don't think that our problem is just the governance, but the people as well. Nigerians are difficult people. We must attest to that.
What about in our homes? Yes, just a very important question. In our homes, because I'm not sure there is any African home you will go to, you will see some packs of painkillers, like the most common, paracetamol.
Okay.
Do you think it's possible to control the abuse of this medication even from our homes? Because I remember when I was young, maybe your belly do you somehow. My mom would say, it's warm. Have you dewormed? They just go and buy one medicine. They'll give you banana or give you sugar illegally in the morning and give you. So in our homes, what role do our families, what role can they play with regards to the, limiting the effects of this self-medication?
Okay, there's what we call first aid. Okay, a family should have basic first aid materials. Okay, just like when a pregnant woman goes for antenatal, they tell you what you have, or post-delivery, you should know what medications you should have in your first aid box. Okay, but you don't, when you have headache or fever symptoms, you don't take those for more than 3 days. When you take and you don't feel better, it's advisable you go see a healthcare professional. Okay, I think we should start from there. I'm a doctor. It gets to some point, I'll tell my husband, you have to see a doctor. Okay, I have kids. I don't, because I'm a doctor, I treat other children. I don't just take it to my care that I must take care of my children. It gets to a point we have to see a doctor. So it starts from the home. I said earlier, you keep drugs out of reach of children. You know where to draw the curtain. You read, when you have adolescents at home, you let them know the importance of taking medications with prescriptions. Okay, I think everything should start from home.
Okay.
Right,
All
yeah.
right. Okay, pharmacist Edith. All right, we're rounding up. So I would like you to a word of advice for people with regards to the use of painkillers and self-medicating. If you were to speak to people watching right now, what would you say to them?
Hmm. So caution is a watchword. Um, be properly guided. Even if you're going to be self-medicating with things like over-the-counter drugs, get proper direction on how to use these drugs. Talk to the pharmacists. Don't just get any drug from anybody just because the person happens to be selling in a so-called drug outlet. You understand? So let the person direct you properly, because that's also one of the ways that you know the difference between a professional and a quack. What's the proper way to use this drug? For how long am I supposed to use this drug? What's the interval? What am I expecting? What are the therapeutic benefits I'm expecting or I'm to expect from a particular drug? What are the likely side effects? These are our rights to know. And then sometimes it beats my imagination how people could walk into a healthcare establishment and they're giving you drugs that have been removed from the packs. You don't even know the name of what you're taking.
But these people do that a lot.
Yeah, and I'm like,
Why?
excuse you? And they go to, as in, hospitals, private hospitals, and they're giving drugs. They don't even know whether they are drugs. So sometimes people come to us, they are having obvious adverse reactions. What drug are you taking? Oh, I went to the hospital and I was given something for my BP. What is the name? Now they removed it from the pack. They were all removed from listers.
We didn't
And
even talk. That's a very important
excuse, and you
conversation.
collected it. So how would you now know if you need an antidote? How will somebody else help you? Do you understand? I know sometimes I've talked to some medical doctors who come up with the excuse that they don't want these individuals to self-medicate. But for crying out loud, it's their right to know what they are taking.
Taking.
So that if they react negatively to it, for instance, my first daughter reacts to penicillin-based antibiotics. So anything penicillin, if it enters her mouth, will be shocked, urticaria, all kinds of reactions. Do you understand? She also reacts to septrin as well. Do you understand? So imagine if she were to go to a private hospital and they give her something like septrin.
And she's lucky because her mother is a pharmacist. She knows it.
She's in the university right now and I might not be with her. Do you understand? And she might come up with certain very funny adverse reactions and she will not be able to know or how to arrest it or anything because she doesn't even know what medication has been given to her. So that's another thing. Even with our healthcare practitioners, please, we have to stop. And sometimes they do this because they don't want their patients to go buy these drugs from pharmacies.
That's just it.
They want to maintain their clients, so to say. So they're endangering these patients. It's their rights. It's their rights. They need to know. So these are some of the things that we need to do. And aside from the sensitization and everything, let them know what they are taking. What name is it? And we even encourage our patients, okay, look at this name. What is it? So that when you come and for people that come for HIV refills and you're not with your pack, you can call the name and we know the name so that the healthcare giver does not make a mistake and give you the wrong drug. Because human beings, we're not computers. We can make mistakes as well. But when you know what you're taking, you can say, oh no, this is not the drug that I always get here. It has happened a couple of times because the person comes with a level of awareness. So my advice to viewers is please know what you're taking, know how you're taking it, and take it the right way.
Okay, thank you very much. Well, you've heard it that self-medication and painkiller use may seem convenient for a short term, but the long-term risk can be quite overwhelming. From organ damage to addiction, the risks are enormous. That is why the key to self-health management practice lies in seeking professional guidance and avoiding misuse of certain drugs, especially painkillers. We would like to thank our guests who joined us in the conversation today on Nonye's Healthy Living Show. It's been an interesting conversation. Well, I'm an no onyano aware and was a onyano onyagwar of course, another person, right? So if you're hearing us now, we're advising that, you might have to cut down on some of those drugs that you take without prescription because it can actually cause more harm than good. We'd like to thank pharmacist Dr. Edith Anyakwo, consultant clinical pharmacist, and the Deputy Director of Pharmaceutical Services, Nnamdi Azikiwe University Teaching Hospital, NEWI. Pharmacist Edith, thank you for your interesting perspective on the program.
Thank you. It was a pleasure.
Okay. We'd also like to thank Dr. Tonia Mbago. She's the Anambra State HIV/AIDS Program Coordinator. Dr. Tonia, thank you for your insights on the Yes Healthy Division today.
Thank you for having me.
Okay, this is where we draw the curtain of the program, but remember that this is still Nonye's Healthy Living Show. Hannah Excellency is committed to ensuring that every Onyanambra knows the right health measures to take to live a more healthier and fulfilling lives. Remember, being healthy is being happy. So today, take a conscious decision to avoid self-medicating. If you feel a certain type of way, please consult a healthcare provider and he or she is going to guide you accordingly. While the program returns next week at this time, I am Priska Wangwo. Thanks for watching.